When I walk in, he stares in confusion. He questions who I am, how do I know him? I remind him. Blankly continues to stare. I tell him who I am the daughter of, how old I am, where I live. I show him pictures, and then I get the, oh, you're my granddaughter. Yes, Grandpa, I am. My grandpa, who suffers from dementia and Alzheimer's, does not remember me, just the memories. As a certified nurse assistant who works with dementia and Alzheimer's patients on a day-to-day basis, I understand the loss of memory and how to handle it. I understand how a family member feels from this disease and what effects it has on the resident itself. Now it is your turn to learn how badly is dementia and Alzheimer's. Let's get started today with how dementia and Alzheimer's affects the brain. Dementia is the loss of ability to think, remember, reason, and communicate. Other terms used include impaired mental function, and cognitive impairment. Dementia is not a normal part of aging. There are two types of dementia: reversible, which can be treated with the person returning to previous level of functioning. Reasons this person got dementia would be poor nutrition prior to admission to long-term care facility, so dehydration or electrolyte imbalances, injury, illness, side effects of a medication, so inappropriate doses, or the CMA mixes two medications together when they're not supposed to. Then there is irreversible dementia, which is a progressive neurological disease. This is where Alzheimer's or AD falls. AD affects the greatest proportion of residents. 5.4 million get diagnosed a year. Once diagnosed, some medications can slow the progression of the disease, while others modify the symptoms of the disease that the resident experiences. There is no complete cure to Alzheimer's. A resident who has had a head injury in the past increases the chances of the disease and symptoms. Goals for the resident with dementia is maintain quality of life and maintain the highest level of possible functioning. A person with AD will die of a different direct cause, such as infection, chronic disease, or complications after a fall. Now that we have talked about how it affects the brain, let's move on to a resident's actions. In general, try to understand the behavior from the resident's perspective. All behavior has a reason. When and where did the behavior occur? What may have triggered the behavior? Are they hungry, mad, sad? Small things often trigger the residents the most. Dementia has damaged the brain's normal function, and the resident does not act this way on purpose. Residents get vague disorientation, unable to determine such things as time, season, or year, where they are located, who they are with, and roles of the person who is present. Often a resident gets a coworker confused with a family member. The behavior may be a protective reaction to discomfort. The behavior may be verbal or physical. If a resident is taking a shower, they may cuss or scream at you if the water is too cold or too hot. They may try to hit you when trying to help them. Resident experiences increasing distress and anxiety that may escalate to violent behavior. Overstimulation and fatigue may make the resident more prone to losing control. I must look for triggers and themes when working with each resident. They're all different. You always have to remain calm, going at a different approach, redirect them. Always be easy with them and go slow. Try to get them to want to do it. Now that we have covered a resident's actions, let's discuss a day in the life of a dementia patient. Anyone who suffers from dementia or AD can vary in symptoms. When talking with the resident, use very simple words and sentences. It is almost like you are talking to a child, but you want them to understand you. Limit environmental distractions such as noise. Since they are older people, loss of hearing will occur. So having their TV or radio blaring while trying to talk to him will not help at all. Using nonverbal cues in addition to verbal requests. At the nursing home, we always keep a constant routine. Residents always ask questions: what time it is, what day, what are we doing? Oh, it's that time already. They forget just about everything, and we're constantly reminding them of what they are doing and why. When going through daily activities, we constantly cue them to do such things. We must ask if they need to go to the bathroom, show them how to brush their teeth, help with clothes, give them medicine because they never remember. Having a family member with dementia is not just that they lose their memory, they lose touch with reality. They slowly unlearn new things that they used to do daily with no difficulty. To conclude, you may now understand a little bit better of dementia and Alzheimer's residents. This disease affects more than just the brain. It affects their life and other lives around them. They may not remember you, but you remember their love they had for you, the memories, the laughs, the photos. You remember them for the both of you.